Narcan Nasal Spray contains the active substance naloxone hydrochloride. It is an opioid receptor antagonist used for the emergency treatment of opioid overdose. Indications: Narcan Nasal Spray is indicated for the emergency treatment of known or suspected opioid overdose. It can temporarily reverse the effects of opioids, such as respiratory depression, and help prevent life-threatening consequences. How to use: Narcan Nasal Spray is administered intranasally, meaning it is sprayed into the nose. The dosage and administration may vary based on the specific situation and the individual's response to opioids. Follow the instructions provided in the packaging or by healthcare professionals. A common initial dose is 4 mg, 2 mg in each nostril. If there is no response after 2 to 3 minutes, an additional dose may be administered. Contraindications: Don't use Narcan Nasal Spray if you are allergic to naloxone or any of the ingredients in the spray. You are not sure if the person is experienced opioid overdose. Special instructions: Narcan Nasal Spray is for emergency use only and should be administered by bystanders. Caregivers or healthcare professionals trained in its use. Administer the spray according to the instructions provided, ensuring the nozzle is placed into one nostril, while the other nostril is held closed. Seek medical assistance immediately after administering Narcan Nasal Spray, as the effects may wear off, and the person may need future medical attention. Side effects: Narcan Nasal Spray is generally safe and has few side effects. However, some individuals may experience withdrawal symptoms such as increased heart rate, increased blood pressure, sweating, or agitation.